12% of the test is reduction of risk potential. Which assessment does the nurse perform first? The client returns from blank surgery and exhibits blank symptoms. Which action does the nurse perform first? So for both of these examples, reduction of risk potential means what? We know somebody's at risk of whatever, and we're trying to minimize the damage. We're trying to prevent complications. We've recognized a complication. We're trying to address it before it causes death. Those are the kinds of things that are reduction of risk potential. So the client returns from, give me a surgery.
Can it be a procedure like a heart cath?
All right. The client returns from a heart cath, and they exhibit what kind of symptom? You want him to have a hematoma?
I can.
Let's do a hematoma. The client returns from a heart cath and they have a hematoma. Which action does the nurse perform first?
Check the distal pulses.
Mm-hmm.
Have you looked at the hematoma yet? So the first thing is to make sure what?
I start to say, well, you've looked at it if you know it's there.
What do you want to make sure is on it?
Ice pack or weight.
It needs to have some kind of pressure on top of it. So maybe one of the first things you're doing is making sure that it's got a pressure bag on it. If you already know that in the stem, then you definitely want pulses next. And what are you doing after that? You got somebody who's got a big bleeding knot.
We're probably going to call the doctor.
We want to make sure that somebody knows that it's there. So we've done two of the things at bedside that we absolutely have to do, right? We've checked on the hematoma. We've made sure that it's got some sort of pressure on it so it's not going to get worse. Maybe marked it to make sure it's not going to get bigger, whatever it was that we needed to do there. We've checked to make sure that the pulse is adequate. And we have to do that before we leave, right? It doesn't do any good to call your healthcare provider if you don't know if the person has a pulse, because then they don't know how much worried to be about it. Is there anything else you might have done at the bedside before you decided to call the provider?
Did you do a blood pressure?
We might want to do a blood pressure and make sure that they're not bleeding internally next. Just to make sure that their blood pressure is not super hypotensive. Maybe we want to make sure that they're not tachycardic, right? Because those are two key indicators for blood loss that's excessive. So now we have lots more data to give. What if the question was that they were post-heart cath, they had a hematoma, and the doctor orders Integrilin. Do you know what that is? What do you reckon it is?
Something to put on the skin? Integ on the skin? I don't know.
It's all right. So let's think about how to figure out our drugs here. If they've had a heart cath, let's just forget about the hematoma for a second. If they've had a heart cath, what kinds of drugs do you expect?
Well, you need something like Plavix, so is that what it would be?
They're usually going to have some sort of a blood thinner. So whether it's oral or IV, they're usually going to have some sort of a blood thinner in that immediately post-cath period to try to keep them from clotting off the stent if there was a stent placed, for example. All right, so let's assume that one of those drugs is now in the stem. They're given something that you would normally get post-cath. Now we can flip the question to the person who develops a hematoma. What do you do first?
Their lab values of like PT, PTT.
Well, if they've developed a hematoma, you're still going to do all the exact same things first, but then you're going to make sure that you have lab work too. Do you see that? You can literally redesign the question however you want to, and then just put in all of the normal things that you would do, and then try to prioritize them. Try to figure out which scenarios that you would not do those things in. So if your person had a hematoma in the stem, but then one of the orders was for Plavix, that easily becomes a which order would you question?